18 out of 19 high-quality studies reviewed by the National Toxicology Program showed that children exposed to higher amounts of fluoride during early brain development had diminished IQ scores. Almost half of those studies had fluoride levels relevant to drinking water in fluoridated communities. That level of consistency across 18 of 19 studies is highly unusual in research and shouldn't be dismissed. Thank you very much. Thank you for the invitation to join you this morning. I wanted to start out with just a little background because I think it's relevant, and that is background of my own work on lead. I'm a physician certified in public health and preventive medicine. I completed my medical degree at the University of Missouri in Kansas City and my public health training at Tulane University in New Orleans. I live in Canada now, but 50 years ago, I went to Alice Landrigan Elementary School in Amarillo, Texas, and I spent my weekends climbing in Paladero Canyon. It was a very formative period of my life. For the past 25 years, I've conducted research on how lead and other toxic chemicals like pesticides and air pollution affect children's learning abilities and their risk for behavioral problems like ADHD and autism. I've served on science committees of the U.S. Environmental Protection Agency, the Centers for Disease Control, and the American Academy of Pediatrics. Most of my studies were on lead poisoning in children, and they were the key studies used by the EPA and the Department of Housing and Urban Development to set federal standards for lead in water and dust. They were also the key studies that led the EPA, the Centers for Disease Control, and the World Health Organization to conclude that no amount of lead is safe for children. 6 years ago, Christine Till, a scientist at York University in Toronto, Canada, asked if I would help her study fluoride in a Canadian birth cohort. This was a cohort that I helped to start with over 2,000 pregnant moms following the children out to now about 10 years of age. This particular cohort, this group of moms and children, is particularly important when we're thinking about fluoride because the cities that we studied, 10 cities across Canada, include fluoridated and non-fluoridated communities. I'd like to share the results of 3 of the studies that we've completed so far. In our first study, we found that the IQ scores of boys were 4 points lower if their mothers had higher amounts of fluoride in their urine during pregnancy. The amount of fluoride in urine is a good way to measure how much a person is exposed to fluoride, but it varies day to day. We also found that the IQ scores of boys and girls were 5 points lower when they were 4 years of age if their mothers had higher levels of fluoride in their drinking water during pregnancy. An op-ed in the Dallas Morning News said that this study was deeply flawed. That's not true. We used the same methods in the fluoride study that I used in my studies on lead poisoning. Our study on fluoride was more heavily scrutinized than any of the other 300 plus studies I've published in the past 25 years. In addition, the National Toxicology Program, which is a program of the United States National Institutes of Health, concluded that our study, our fluoride study, was a high quality study. In fact, our results are consistent with most other high quality studies. 18 out of 19 high quality studies reviewed by the National Toxicology Program showed that children exposed to higher amounts of fluoride during early brain development had diminished IQ scores. Almost half of those studies had fluoride levels relevant to drinking water in fluoridated communities. That level of consistency across 18 of 19 studies is highly unusual in research and shouldn't be dismissed. In the second study, we found that women who drank tap water with higher levels of fluoride were at higher risk for hypothyroidism, a low functioning thyroid gland. That shouldn't be particularly surprising. In the past, fluoride was used to treat patients with hyperthyroidism, that is, a hyperactive thyroid. Hypothyroidism in any woman is a problem, but it's especially problematic for pregnant women because the developing fetus is wholly dependent on their mother's thyroid hormones. They don't make their own thyroid until beginning in the second trimester. In the third study, we found that boys whose mothers had higher fluoride and lower iodine during pregnancy did even more poorly on IQ tests than boys whose mother had higher fluoride and normal iodine. Iodine, as all of you know, is a critical vitamin for thyroid hormone. Children who are born in communities with really low iodine are at risk for cretinism, a severe form of cognitive or intellectual deficit. So what can we conclude? Not all studies show that children who are exposed to higher levels of fluoride do more poorly on cognitive tests, but over 90% of high-quality studies do show that fluoride results in IQ deficits in children. In the Dallas Morning News, the authors of an op-ed said that there isn't a credible other side to the fluoride question. I disagree. The NTP, the National Toxicology Program, concluded that levels of fluoride commonly found in pregnant women are harmful to their children. I applaud Dallas City Council for asking these tough questions. Questioning is a critical part of the scientific process, and the public, especially publicly elected officials, should be involved in science. These questions, like whether pregnant women and children should be exposed to fluoride, are simply too important to leave up to scientists and public health officials. Thank you very much.